Hi, I'm Dan Lagani with Silver Solutions, the senior-focused home services company. Welcome to another episode of AgeWise. Our goal with the program is always quite simple, and that is to make you a little smarter about something that you'll need to know as you and your loved ones grow older. We sat down with today's guest, Dr. Laura Gitlin, the Dean Emerita at Drexel University's College of Nursing and Healthcare Professions, a couple of weeks back and had a wide-ranging conversation about things like innovations in dementia care. We also discussed the book she wrote a couple of years ago called Better Living with Dementia, training for the next generation of healthcare professionals and what they'll need to focus on to be even more equipped to deal with age-related disease here in the 21st century. And we focused on her latest area of focus, which is the We Care Advisor Study. All of those topics discussed in a great 20-minute conversation. So whether you have someone in your family or life that's suffering from some form of cognitive impairment, or you simply want to be better informed about one of the critical topics of our time, this is a great conversation and something you'll find very worthwhile. So please enjoy Dr. Laura Gitlin here on AgeWise. Dr. Gitlin, thanks so much for joining us today on AgeWise.
Thank you. I'm so happy to be here, and thank you for your focus on dementia care.
So I went through in the intro about your background, and there are so many pieces to it, but how do you describe what you do and what you're focused on to friends?
Yeah, so it's a hard one. It's a hard question. Formerly a sociologist, and I refer to myself as an intervention scientist because I work with many members of my team who represent different health professionals to develop and evaluate different approaches to help older adults live better and with life quality in their home. And some of my most recent endeavors have been to focus on dementia care and working with people living with dementia and their family caregivers. But essentially, I develop interventions, I test them. When they're effective, we try to implement them on a large scale and get them into practice.
When you think about the advances in even using the title of your book, Better Living with Dementia, what has changed for the better? Are we talking about simply managing the disease, or are we actually seeing inroads being made in curing forms of dementia and cognitive impairment?
There is not a cure. There will not be a cure for quite a while, but there are some beginning breakthroughs for disease-modifying therapeutics, so to slow the disease progression. And then we have a whole host of what we call non-drug, non-pharmacologic approaches that can really help people better manage and live better with life quality and for a longer period of time with the disease. So in terms of its prevention, not cure yet, and management, we're seeing great inroads.
Let's start then with prevention. What are three important things that everybody can do in their lifetime to help prevent the onset of dementia?
Well, Dan, in 2017 and then in 2020, and now just recently, the Lancet, which is a very prestigious international journal running out of England, commissioned investigators, and I was very honored to be one of about 30 investigators worldwide to participate, to look at this very issue of prevention and management. And the 2020 report actually identified 12 factors that we could act on, not just 3, but 12 factors that would account for, or let's put it this way, reduce the risk of dementia by 40% in the population at large. And these factors can be thought of: what can we do at a very early age? What can we do in middle age? And what can we do in older adult age? And I think one of the benefits of these factors, or understanding these factors, is a general principle that it's never too early and it's never too late to prevent dementia.
So what are some of the factors?
I'll give you an example, but I'm going to skip to old age and stopping smoking, for example, exercising, physical activity, heart disease, attending to cardiovascular factors. What's good for the heart is good for the brain. Controlling diabetes, preventing and controlling diabetes, for example. Those are all factors. And also social isolation. Making sure that you remain in old age connected socially. And that social isolation has been found as a risk factor for cognitive impairment and dementia.
We have a healthcare system that does really a good job of acute care of very specific issues, but the holistic understanding of aging and what needs to be in place to age well and live better longer isn't really in place. What's at the core of that?
Yeah. Well, first of all, the diagnosis of dementia is one of ruling out symptoms and then also having various kinds of the MRI or PET scans and blood tests, et cetera. It's not simple, straightforward. You don't go in for a strep test, or to check for a strap, your throat, or you have a flu or cold. So the process itself takes a little time and a little know-how. So I think that's part of it. And the other thing is, in a 15-minute primary care, visit, there isn't the ability to really go into depth. Now, with Medicare's yearly wellness, which checks, which allow for reimbursement for exploring all different aspects of wellness, that's a breakthrough in helping primary care really examine the cognitive issues, social isolation issues, if someone's a caregiver. So we have a little bit of breakthrough. But I would say that it's both the preparation of our healthcare workforce and the payment mechanisms and the lack of trained healthcare providers who can provide a systematic analysis and assessments for a diagnosis.
Let's talk a little more about the impact on the family caregiver. Most people, again, just based on the numbers that you ran through, I've heard estimates, by the way, that were as high as over the age of 80, upwards of a third of people had some form of cognitive impairment.
Yes.
So the likelihood that in our lifetimes, whether we have a cognitively impaired issue ourselves, we will know someone that does. What's the best thing that somebody can do to prepare for the role of caregiver?
One of the things that when my friends or family members call me and say, so-and-so in my family just has a diagnosis, I'll say the first thing I say is make sure you continue exercising, eating well, and you do not cancel any of your doctor appointments. And I routinely hear, how did you know that? I just canceled my dentist and my primary care. I said, don't do that because you have to take care of yourself. That's the main message here. A family member has to be able to take care of themselves. They're in this for the long haul. So keeping up with a network of friends and families, determining what members of one's social network can help in different ways very early on is really essential.
You wrote a book a couple of years ago called Better Living with Dementia. What was the impetus for the book? And who is it actually written for? Is it written for the layman? Is it written for industry professionals? Tell us a little bit about it.
The book provides systematic reviews and evidence for various aspects of how to live well with dementia. And that's the main message. We know how to make homes safe. We know how to help family caregivers take care of themselves. We know how to help families and individuals living with dementia engage in activities that are meaningful to them, which is a very important part of living with dementia, to be fully engaged and have a sense of purpose. We know also other research questions that need to be answered. So we think the book is for anybody and everybody.
You mentioned something that's near and dear to what we do at Silver Solutions. And when you made the comment, we know how to make homes safe. So what are the things that you recommend that anybody that has some from mild cognitive impairment to a more advanced issue with dementia should have in place if the care is taking place at home? What are the things they can do that they should do in order to ensure their safety?
In life, our homes become very cluttered, right? If you look at, I know my kitchen table, it has the newspaper, it has bills, it has my iPad. I mean, what are you supposed to do at that table, right? And so with the progression of the disease, those kinds of mixed cues in the environment become very difficult for a person living with dementia to discern. So with disease progression, decluttering is really important. And that means removing objects that are not necessary for whatever is going to happen in the place that you're looking at. We've been in homes with, people have stacks of newspapers all over their house, tripping hazards. I can tell you right now, my computer cord is such that if I got up a certain way, I might trip.
Really wonderful insights. And what's interesting is among the services we provide, the first one is to help people age safely at home. And the idea of decluttering is central to that. And, it's just really sound advice. Tell us about what your focus is. You recently evolved out of being the dean to a dean emerita. Where are you focused now, post your full-time experiences at Drexel?
Yes, thank you for asking, because I'm so excited to return 100% to my research. So I did become a dean, what we call a research dean, where I did keep a modified program of research, but I'm very excited to return to it. And I have some really exciting programs that are funded by the National Institute on Aging in particular that we are working on. One is called the We Care Advisor. It's my colleague out in University of California, Davis campus, Dr. Kales, and I have developed a platform called We Care Advisor that's for family caregivers who are really challenged by managing different kinds of dementia-related behavioral symptoms, restlessness, agitation, aggressive kinds of behaviors. And it moves caregivers through a series of very easy to use questions. And from that, we generate what we call a prescription of strategies to help the family member, the caregiver, use these strategies. And we ask the caregiver use them for a week, come back to the tool and evaluate what worked and what did not. And this is an open enrollment study. We can enroll anybody across the country, and we're still enrolling. So you just have to email wecare@drexel.edu.
Dr. Laura Gitlin, thanks so much for being our guest today on Age Wise and for helping to make us all a little bit smarter about living better longer. I'm Dan Lagani. For those of you who like this episode, please share it with a friend. And if you want back episodes of Age Wise, you can find all of them by going to silversolutions.com and clicking on the video tab. And to make certain you get the episodes as soon as they come out, just go to the Apple Podcast platform and press subscribe. For all of us here at Silver Solutions who work hard every day to help make living better, longer, and safer, stay safe and be wise.